Qualified registry was set up to look at internationally, not just in North America and Europe, but right across the world. Was there some sort of association between compliance to guidelines and better outcome for our patients? Because we all read the guidelines and we assume that's the case, but we wanted contemporary evidence. So we looked in 39 different countries, 6,700 patients that had been admitted to hospital with heart failure, and then just looked at how well they did. Design was like a prospective registry of patients in these 39 countries, selected a variety of centres, so truly international. And when the patients were identified, so this is systolic heart failure patients that had been admitted between 1 and 15 months before they entered the registry, we've then been following them up. And we just published this week in the European Journal of Heart Failure the 6-month follow-up. The interesting findings were, because we applied a score to the patients to see how compliant their physician's prescriptions were to the guidelines. So you got 0 if there was no compliance, you got 1 if they were fully compliant for treatment with ACE inhibitors, beta blockers, aldosterone antagonists, and if in sinus rhythm, ivabradine. And what we found was a very close relationship between adherence to the guidelines and outcome for patients. So to give you an example, at 6 months, a patient who is being managed highly similar to the guidelines has half the risk of being dead compared to those that are poorly compliant to guideline advice. So really powerful impact for all-cause mortality, cardiovascular mortality and heart failure deaths, very strong association. Well, a lot of people will say, well, we know that patients are easy to treat. We can give them all the therapies they need and they're going to do well. But we actually adjusted for that in our multivariate analysis. So this is showing even more important in contemporary practice to think about very carefully about the patient in front of you. What is their type of heart failure? What do the guidelines suggest would be good therapy? And try and get them on the best therapy possible. And we can reassure ourselves that effort is worth it. It's not just hospitalization, it's actually mortality benefit from using these drugs. Perhaps you might say that's no surprise, we've got the randomized trials, but here this is real world evidence confirming 39 different countries, the same association. Practice the guidelines, your patients will do a lot better. I think we need even more evidence about how can you make doctors and nurses follow guidelines more closely. How can we incentivize them to do that? What kind of education do we need to provide? And how can we work with patients and their families to make sure that they're also aware of what their treatment should be and narrow the gap between the guidelines and what happens in practice. So a lot of work to be done, but I think this study, the Qualified Registry, just confirms what we should know. We've got the guidelines, they're based on very strong evidence. Put it into practice and it will really make a big difference for the patients you treat.